Lexi.
I'm Andrew.
I'm Micah.
And we are going to be talking about the Affordable Care Act. And we're going to be talking about pros, cons, and an alternate plan that could be used in place of the Affordable Care Act. I'm going to be discussing 10 pros, and then Lexi's going to be discussing the first 5 cons, and Micah will do the last 5 cons. And all of these pros and cons were from an article on thebalance.com. So that's where all these statistics and facts come from. So without further ado, the 10 pros. The first pro of the Affordable Care Act is that it slows the rise of healthcare costs. It provides insurance for millions and makes preventative care free. So obviously this is a pro because lots of people that didn't have insurance are now getting insurance. And then people receive treatment before needing to go to the emergency room, so this is lowering costs. So people are getting more treatment at prompt cares and primary care provider offices instead of going to the emergency room. So this is eventually saving money by preventing people from going into the hospitals and acute care. Number 2 is that it requires all health insurances to cover 10 essential health benefits. These benefits are preventative and wellness visits, including chronic disease management, maternity and newborn care, mental and behavioral health treatment, which is one of the newer things that is added to like insurance coverage in general and the Affordable Care Act. Number 4 is services to help people with injuries, disabilities, or chronic conditions. Lab tests is number 6. 7 is pediatric care. 8 is prescription drugs. 9 is outpatient care. 10 is ED or ER services, 9 is ED ER services, and 10 is hospitalizations. So all of these are great because these are things that are probably necessary to be covered under insurance. The third pro is that insurance companies can't deny people for pre-existing conditions. So that means if you have like a chronic illness or like a mental illness of any kind that is diagnosed, you can't be denied insurance because of that. Also, this means that the insurance companies can't drop clients or raise their premiums if their clients get sick or if they get a new diagnosis that's like chronic disease or acute disease. The fourth pro is that it eliminates annual and lifetime coverage limits. So that's pretty self-explanatory. The fifth pro is that kids can stay on their parents' plans until the age of 26. So this is also something new for the insurance world in general. So as of 2012, more than 3 million previously uninsured young people became insured because of the Affordable Care Act. So this is largely due to the advancement of the age that you can stay on your parents' insurance coverage from, 18 to 26. So that's an 8, yes. I was trying to do the math, an 8-year difference, which is good. The sixth pro is that states must set up insurance exchanges. That's also pretty self-explanatory. The seventh pro is that it will eliminate the Medicare gap in coverage by 2020. So this is projecting that by the year 2020, the Affordable Care Act will eventually close the gap that Medicare currently covers in terms of costs. The eighth pro is that the middle class receives tax credits on their premiums. So this is good because there's a large part of the population that's in the middle class, and they will be getting sort of a tax break on their insurance premiums. The ninth pro is that businesses with more than 50 employees must offer health insurance. So it previously was not like this. Businesses that had more than 50 employees were not required to offer insurance plans or benefits for their employees, but now they are required to. And then the 10th pro is that it is expected to lower the budget deficit by $143 billion by 2022, which is obviously good because who doesn't want to lower the budget deficit? So that's a summary of pretty much of the 10 pros, or some of the pros, I guess, of the Affordable Care Act. So Lexi is going to talk about some of the cons.
I'm going to discuss the first 5 cons. Our first one is that 3 to 5 million people lost their employment based on health insurance. Many businesses found it more cost effective to pay the penalty and let their employees purchase private insurance plans, while other small businesses find that they can get better plans through state-run exchanges. So that can be stressful for employees, especially if they have pre-existing conditions like cancer, because it can be harder to get an insurance to accept them. Because like we stated with the pros, they can't drop clients, but that doesn't mean they don't have to accept you. Our second one is 30 million people never had company plans and relied on private health insurance. So this is a con because many people are having to switch between company to private health insurance. So it's an inconvenience for individuals and companies because it's expensive, it takes a lot of time, and it takes a lot of work to switch people from one to the other. Our third is increased coverage raised overall healthcare costs in the short term. This is due to the fact that many people receive preventative care and testing for the first time. So it's very costly because all of a sudden all these people that never had insurance all of a sudden had it. So they're going to the doctor and they're going to go get like prescriptions, they're going to go get all these tests done, and it's just all of that money suddenly everywhere. The fourth one, the Affordable Care Act taxed those who didn't purchase insurance, and then many people still avoided taxes through a list of exemptions. And it's per person $700 per year to not have insurance. So that can be pretty, it's not as costly probably as having insurance, but it's still pretty costly.
Mm-hmm. And then you also have to pay for like doctor's visits,
right.
ED visits, ambulance,
yeah.
whatever, all that stuff, prescriptions.
Yeah.
Prescriptions are really expensive if you don't have insurance.
Yeah.
So.
And then number 5, 4 million people chose to pay the tax instead of paying for coverage. So people thought of the Affordable Care Act as an inconvenience, or they didn't agree with what it offers, or they just really wanted to stick with their private insurance. And Micah is going to come with the last 5 cons.
So the 6th con that we found, in 2013, the Affordable Care Act raised the income tax for 1 million people with incomes at about $200,000. The next one, starting in 2013, medical device manufacturers and importers paid a 2.3% excise tax. This might discourage companies from hiring new employees due to it's so expensive to make and import these devices that they refrain from it. Number 8, before 2013, families could deduct medical expenses that exceeded 7.5% of income. After the Affordable Care Act, it was raised to 10%. This led to a 2.5% increase, which adds up for people who do not make a large amount of money. The 9th one, pharmaceutical companies pay an extra $84.8 billion in fees between 2013 and 2023. This pays for the closing the donut hole in Medicare Part D.
So, sorry to interrupt you, but this is what I was talking about in the earlier pro about it's going to eliminate the Medicare gap in coverage by 2020. So that's a good thing, but it's a pro, but it's also a con because it's going to cost $84.8 billion
Right.
to do it. So that's why it's a con.
And the last one we found, in 2022, insurance companies will be assessed a 40% excise tax on expensive health plans. These plans include premiums of upwards of $27,500 for families and $10,200 for individuals. Lots of these plans are for people that have high-risk jobs such as construction or elderly workers. With this increase of tax, it will discourage people from receiving insurance due to the tax increase if they make more than $10,000 themselves or $27,000 as a family.
Which a lot of people do.
Yeah.
I think.
That's
So,
very
And then
common.
go back to that like 84.8 million. So like, does that also play into on our pros how it lowers that budget deficit by that much? Does that play into that?
I think so, yes. I think that this is taking into the account that eventually, like, when the Medicare gap is closed,
Yeah.
we're gonna start
Yeah.
saving money.
Right.
But to get
Awesome.
there, we have to spend
$84
million.
Right.
So that's why it's like,
The balance.
Yes.
on that.
yes.
And there are plenty of alternatives to go with. Some are better than others. What we chose to go with was what a vast majority of the developed world goes with for their healthcare system, and that would be the universal healthcare system. So some of the countries that are the main front runners that you think of when you think of this are Canada, Sweden, Switzerland, France, the UK. They all have
Basically,
it.
everywhere.
Yeah,
There.
and the Nordic countries. So out of the top 25 healthiest countries in the nation, or in the world, sorry, 16 of them all identify as universal healthcare systems. And so before Obamacare, 46% of emergency department patients came in because they had no other place to go. They didn't have a primary care physician, so they had to go to the emergency room because by law the emergency department has to see a patient regardless of whether or not they can pay. So this greatly showed the healthcare inequalities. So that was a big reason for the cost of medical care rising, is to that they can compensate, and that's where some people say, oh, well, the universal healthcare, I don't want to pay for other people's healthcare, when in fact we already are doing that by raising the medical care costs just to compensate for the people that can't pay.
And that's super expensive. Like if someone's going to, if someone has a cough and they're going to the emergency room instead of going to a prompt care, like
Yeah.
they're spending hundreds of
Hundreds,
dollars
thousands
going
of
to the
dollars.
emergency room
Yes.
instead of paying a $20 copay to go
Right.
to prompt care.
Exactly.
So,
So universal healthcare works as a facet, and what it is as long as you are maintain your citizenship in the territory, country, however the entity decides to define themselves and their borders, as long as you maintain a citizenship in that, then you can get basic healthcare needs, no charge to you. You go in, you can receive them. So one of the main things that this does is it eliminates the administrative costs of dealing with private insurances, public insurances, government facilities. And so the United States healthcare system has been, over the years, kind of shaped and molded by insurance, different medical concerns, and pharmaceutical companies. So it's raised prices, but with the universal healthcare, it lowers the overall healthcare cost for the entire economy as itself. And the way it works is the government controls the pricing of medications, controls the pricing of services and fees through negotiations and regulations. That way that everyone's receiving the same cost. So this also standardizes the services, because in the United States there's a vast majority of health disparities between the rich and the poor, and so that this helps eliminate those. So it forces hospitals and doctors to provide the same standard of service, in turn at a lower cost, because in a competitive environment like in the United States, for instances, there are vast medical companies that are trying to get theirs as the main focus. So in ours, our focus is on new technology, new advancements. So companies offer these brand new things each and every month, so they're vying to try and get that. Well, then doctors are going, okay, like I'll use this, and then they end up being paid more. And so they target the wealthy in the United States healthcare system, where it is a universal right, in my opinion, that someone has the right to be healthy. And just because they were born with this condition does not mean that they shouldn't have insurance, or it's a harder time, or they don't get the coverage that they need. So,
and sorry to interrupt you, but I think that's like one of the reasons why a lot of people are against the Affordable Care Act, is because pharmaceutical companies, like medical, like companies that make medical devices, like they're no longer going to be able to charge like outlandish
Right.
amounts of money for something that they produce. It's all going to be standardized, and it's going to be cheaper. So these people aren't going to make money, and they don't like that. So that's
and Obamacare is a step toward that direction, trying to get the healthcare equality more equal and the disparities to what they are. But I think for the United States to truly become one of the evolved nations that it is in most aspects of its life, we really need to follow the lead of most developed nations and go ahead and switch to the universal healthcare system.
That's it.
Thank you for that.